Good morning, my name is Kasermisi Kaime from BSN 111K Group 41, and today I will be performing oral administration of medication return demonstration. So oral administration is the most common, least expensive, and most convenient route administration for patients. So prior to the procedure, I have to check the physician's order to ensure that you get the right or correct information about the physician's order to avoid any misinterpretation. And the next is we have to check the MAR or the medication administration record with the physician's order for drug name, dosage, frequency, and route. This is to avoid having medication error when you're preparing the prescribed medication for the patient. And the next is we have to verify client's ability to take medication orally. This is to determine if the client can swallow the medication that we are going to administer. And the next is we have to organize the supplies and brings the requisites to preparation area. And the requisites included are medicine cup, medicine tray, and if needed, a stethoscope, and a sphygmomanometer. And then after that, we have to perform hand hygiene to deter the spread of microorganisms. And then, we have to read the MAR and take the appropriate medicine in the box. And then we have to read the label and removes medicine from the box. And then we have to compare the medication against the order on the MAR. And then rechecks the label of medicine with the MAR. And we have to also note the expiration date. So in preparing the prescribed medication for tablets or capsules, if in a bottle, we have to gently shake the prescribed number into the bottle cap, and if it is in a box, we have to shake the prescribed number into the medicine cup. This is to ensure that the medications that you are giving is clean. And then for liquids or suspension, we have to thoroughly mix the medication and then remove the cup and place it upside down on the counter cup to avoid any contamination. And then we have to hold the bottle so the label is next to your palm, and we have to pour the medication away from the label. So next is we have to place the medicine cup on a flat surface at the eye level. And then we have to place the thumb on prescribed level and reads at the lower meniscus. And then after that, we have to pour the exact amount of medicine prescribed into the medicine cup. Then after pouring, we have to wipe the rim of the bottle with a proper towel or the tissue before we have to cap the bottle. This is to prevent the cap from sticking in the bottle or in the rim of the bottle. So for drops, you have to use a medicine dropper and just up the exact amount needed. And then we have to place the filled medicine dropper inside the medicine cup. And then we have to place the prepared medication and MAR together on the medication cart. Then after that, we have to check the room number against the MAR before entering the client's room. This is another safety measures to ensure that the nurse is entering the correct client room.
Close the door to provide privacy.
Hi, good afternoon, ma'am. My name is Calcer Missy Kaime, your student nurse for today. May I see your wristband, please? Can you state your complete name
Luis Gutierrez.
and your birthday?
September 1, 1994.
Okay, so now, ma'am, at this time, I will be giving your medication as prescribed by your attending physician, Dr. Kaime. And may I ask if you have or you are aware of any allergies from your medication or drugs?
No.
Alright, so if the medication is highly acidic, such as aspirin, we can give the client or the patient with some snacks, such as crackers, if food is not contraindicated. So now we are going to match up the MAR with the name of the medication as shown on its label and with the client's name. So if needed, we have to perform pre-administration such as taking the pulse rate, respiratory rate, or the blood pressure of the patient. So now, ma'am, before I will give you your medication, I have to check for your pulse rate and your blood pressure. Would that be alright?
Okay, sure.
Okay. Alright, thank you. And now I will be getting your blood pressure. So now we are going to discuss the medication to the patient. So ma'am, Dr. Kaime has prescribed you with Advil with a generic name of ibuprofen with a dosage of 200 mg to be taken in every 6 hours, and it is in capsule form, which means that you have to take it orally. So ibuprofen is a pain reliever and a fever reducer, which will temporarily relieve your aches and pains due to headache, backache, common cold, and muscular pain or aches. So now we are going to assist the patient with in a sitting position. So since the patient is already in a sitting position, we can now administer the medication. We should also give the patient sufficient water or preferred juice to swallow the medication. So when the patient is taking the medication, we have to stay until the client has already swallowed the medication. So ma'am, this is your ibuprofen. Alright now ma'am, so since now that you are done taking your medication, I am going to leave you now so that you can have some rest. Do you have any questions ma'am, or do you need anything?
Nothing. Thank
Okay,
you.
so I will be back here for few minutes so I can check up on you. Thank you so much for your cooperation.
Thank you.
So after administration of the oral medication to the patient, we have to document the following. First is the medication given, the time, and the route given. And also, if there is any complaint or assessment of the client, we also have to document it. And then, if medication was refused or omitted, we have to document the reason of omission. And also, we should not forget our signature because this will signify that we have carried out the doctor's order. And then we have to replenish stocks and return the cart to the appropriate place. Because it is that all tools should be properly maintained or kept so that the workers are not be endangered. And then lastly, we have to do an aftercare of equipment. We have to soak, rinse, and dry the equipment used and returns to proper places. This is because preventive maintenance is the systematic care and protection of equipments in order to keep them in safe and usable condition that limits downtime and extends productivity.